Today we will be talking about the topic of obesity and its associated health risks. Ultimately, by the end of the session, which should take no longer than an hour, your knowledge on the subject should increase. Hopefully, your scientific skills will also increase by the end of this session. So, before we do anything, who am I? Well, my name is William Back, and I'm a final year pharmacology student at the University of Manchester. I'm originally from Nottingham, but have lived in Manchester and America, where I worked in a pharmacology lab for a year studying heart tissue. Before we start the session today, we need to acknowledge that we will be covering some difficult topics, both obesity and cancer. Now, obesity is a difficult topic to talk about due to the sensitive nature of body image issues, and for this reason is often excluded from the school's curriculum. Cancer is a topic that is more often covered within the syllabus, but some find it a difficult conversation to navigate. If you're finding any of these discussions in this presentation difficult, feel free to pause the recording and take the breather. I hope you see this presentation as one that is aiming to educate you rather than scare. Hopefully, by the end of this presentation and once all activities are complete, you will be able to tick this list off. So, your first activity of this session is a nice easy one. Instead of telling you the key words you should know and understand by the end of the session, you're being encouraged to actively find them in a word search. You'll be given 3 minutes to complete the word search, which is adequate time to complete the objective. The activity has been given to you and should be found as starter_word_search_PDF. Once this timer begins, that is when you should start the word search. Good luck, guys. In case you couldn't find any of them, here are the answers for the word search. Hopefully you should know some of these words and have some understanding of what they mean. Following on from the word search, you'll now be asked to complete a quick multiple choice quiz. There are only 8 questions, so it shouldn't take you long at all. Once you've completed it, if you could either take a photo of your answers or write them down somewhere, that would be very helpful for later on in the slideshow. The quiz can be found as starter_quiz_PDF. So now that we've completed the starter activities, we can move on to the main subject of the presentation, obesity. So why are we talking about obesity? According to the World Health Organization, or WHO for short, we are in an obesity epidemic as well as the COVID-19 pandemic. Obesity has tripled in the past 30 years or so, with 2 billion overweight adults in the world and 650 million obese individuals. A recent 2021 study has also found that the COVID pandemic has only increased the number of obese individuals, making the obesity epidemic worse. The next slide is a nice introductory video to the rest of the topic. Your first activity requires you to think of yourselves as doctors. Someone has messed up and given you incomplete patient notes from a consultation. You need to figure out what's wrong with each individual, then diagnose them with a disease. You'll also need to use the fact files given to you to come up with some follow-up notes. These can be further tests that need to be done or medication that needs to be prescribed to attenuate symptoms. There are some blanks on each form that need to be completed too. This activity should take you between 10 and 15 minutes to complete, and to help you, we will go through an example together. This is just a quick example of a fact file that you'll be given. Thankfully though, yours will be completed for you. This slide is similar to the previous one you've just seen, although this time it won't be completed. In fact, it's your job to complete all of the form. This is an example of a patient form. We'll complete this one together. So as you can see, this patient, Mr. Rogers, is a 52-year-old male that is 189 centimeters tall and weighs 74 kilograms. His BMI has not yet been calculated, so that's what we'll do first. This is the equation we need to calculate BMI. It was also shown in that video we watched. So what we need to get is his weight in kilograms divided by his height in meters squared. So to calculate Mr. Rogers' BMI, we need to divide 74 by 1.89 squared. This gives us a BMI of 20.7, and so we can classify Mr. Rogers as healthy according to the BMI system. After reading through his consultation notes, we can identify some key symptoms, which are now all underlined in red. These are all symptoms of psychosis, a disease that's not covered in today's session, but if you continue to study biology and further education, you'll become very familiar with. Psychosis isn't one particular disorder though, so further tests need to be done to determine the exact disorder. This can be something such as bipolar disorder or something such as schizophrenia. We could also prescribe Mr. Rogers some antipsychotic drugs, such as chlorpromazine, to alleviate some of the psychotic symptoms he's experiencing. Now that we've done one together, it's your turn to do them. You should open the files activity_1_factfiles_pdf as well as activity_1_worksheets_pdf. These are all the resources you need to complete the first activity. You can now pause this presentation here, giving you adequate time to perform the activity. The first patient we'll go over is Mr. Simpson. Using the BMI equation, we can work out that he has a BMI of 33.4, making him obese. He has two risk factors underlined in green. He also has his key symptoms underlined in red. From these symptoms, we can deduce that Mr. Simpson suffers from atherosclerosis. To conclude this diagnosis, angiography could be performed, which should show narrowed blood vessels. He has also been told to change his lifestyle, and if this fails, he has been prescribed some pharmacological interventions. The next patient we'll discuss is Mr. Griffin. We can calculate his BMI to be 32.5, which equates to being obese. He has excessive alcohol intake, which is a risk factor, as well as displaying some key symptoms of the disease underlined in red again. His symptoms suggest that Mr. Griffin is suffering from type 2 diabetes. This diagnosis will be confirmed if his urine presents glycosuria, the presence of glucose in his urine. He has also been told he needs to change his lifestyles, similar to Mr. Simpson, and he's also been prescribed some pharmacological interventions. The next patient we'll look at is Mrs. Puff. This time we got given Mrs. Puff's BMI, but not her weight. So if we do a quick rearrangement of the equation, we can find out that her weight is equal to 116.6 kilograms, which equates to being an obese BMI of 36.4. She has one risk factor underlined in green of muscle overuse and two disorder symptoms underlined in red. From these symptoms and risk factors, we can diagnose Mrs. Puff with osteoarthritis. X-rays can confirm this to observe osteophyte formation. Mrs. Puff should then see a physiotherapist as well as take medication to aid in pain relief. Eric Cartman, similar to Mrs. Puff, has his weight missing from his fact file. Following the same rearrangement we did previously, we can find his weight to be equal to 40 kilograms. This makes Cartman overweight. Cartman has one risk factor, underlined in green, which is hypertension. This time it is not a symptom because he is on propranolol, a beta blocker that has risk factors in certain disorder. He also has symptoms similar to that of someone who is depressed, thus we can diagnose Cartman with depression. To alleviate depression, Cartman has been told to see a therapist and has also been prescribed the antipsychotic drug phenolzine. Our last patient is Muriel Bagg. A more complicated rearrangement is necessary to calculate her height this time. Once we have rearranged the equation, we can find her height to be 185 centimeters or 1.85 meters. As her BMI is 26.1, we conclude that she is overweight. She has 2 risk factors in her fact file, both underlined in green: smoking and excessive alcohol intake. She also has 4 symptoms of a stroke patient, all underlined in red. Therefore, immediate action must be taken. Stroke can be confirmed with a scan, either an MRI scan or a CT scan. Following recovery, Mrs. Bagg is advised to go to speech therapy and take streptokinase and heparin. One disease that wasn't covered in our first activity but was mentioned in the video at the start of the session is cancer. In the past 2 decades, numerous scientific articles and reviews have linked cancer to obesity. Since this initial relationship has been discovered, countless papers have attempted to identify the mechanisms that link the 2 diseases together. This is something that we will hopefully be able to do by the end of this session. But before that, we need to have a look at cancer overall. So before we delve into the mechanisms that link obesity and cancer, we'll have a brief overview of the cancer itself. It is often covered in curriculum in school, so some of this should be familiar. Remember here that this is a session to inform you and not to scare you. Cancer is not one disease, in fact. Cancer is a spectrum of diseases with over 200 different types that have distinct characteristics that we will cover. We'll begin by looking at cancer's prevalence and cancer's mortality rates. Men have a slightly higher chance of developing a cancerous disease than women. Cancer also claims an average of 450 deaths per day in the UK, or that equates to 166,000 cancer deaths every year. Prevalence has risen due to increased screening, so we've seen an approximate 15% increase over the past few years in cancer cases, and mortality rate has decreased by almost 30% in the past 30 years. Mortality is decreased largely due to reduced smokers, so reduced risk factors, and because of the subsequent reductions in lung cancer mortality. Treatment breakthroughs have also contributed to this decrease in mortality. However, when comparing cancer to other diseases, such as heart disease, the mortality rate has not declined to the same extent, so we're still looking at improving our knowledge of cancer and therefore how we treat the disease. These are some of the graphs taken from the same article that we gathered some of the facts from for the last slide, and they are data points collected from patients in the United States, not in the UK, so there's a bit of a difference there. The blue line represents the actual number of cancer deaths recorded each year, whereas the red line represents the number of cancer deaths that would have been expected if cancer death rates had remained at their peak, so we hadn't got improved treatments or reduced risk factors. So we can see there that there's been a big decrease in mortality rates within the past 20 years, so nice visual representation of the last fact we've just seen. This slide encompasses the cellular nature of a cancerous disease. Cancers are characterized by tumours or neoplasms which arise from a normal tissue and are often the result of a singular faulty cell that is replicated. Neoplasms are purely just a medical term for tumours. These neoplasms can be benign or malignant depending on whether they are restricted to a single site or have invaded other tissues. Some people also believe that cancerous neoplasms are only solid growths. This isn't always the case. Neoplasms can actually be liquid, and is the case with leukemia. As we addressed in the previous slide, cancer often arises from a single faulty cell, so cancer therefore has a genetic basis. In a normal homeostatic cell, the action of oncogenes, or cancer-promoting genes, is balanced by tumor suppressor genes. In a neoplasm, though, either genetic damage from carcinogens or random mutations in the genome can result in the imbalance of this homeostasis. This can either increase the activity of oncogenes or decrease the activity of tumor suppressors. This results in an imbalanced activity of these genes, causing uncontrollable growth. Factors known to induce oncogene mutations include alcohol, smoking, and ultraviolet light. As we said earlier in the presentation, cancers have distinct characteristics. In 2000, Hanahan and Weinberg released a journal article that would define the era of oncology studies. They suggested that the vast catalogue of cancer cell genotypes is a manifestation of 6 essential alterations in cell physiology that collectively dictate tumour growth. The first property, sustaining proliferative signalling. No type of normal cell can proliferate in the absence of stimulatory signals, such as growth factors, but if a mutation occurs in an oncogene, these signals can be mimicked. The second factor is evading growth suppressors. Within normal tissue, many anti-proliferative signals exist thanks to tumour suppressors, like TP53, that controls tissue homeostasis. Impatient cancer cells can evade these signals if there are disruptions to tumour suppressor genes and progress into later stages of the cell cycle. The capability for invasion and metastasis enables cancer cells to escape the primary tumour mass and colonize new terrain in the body where, at least initially, nutrients and space are not limiting. Through other acquired capabilities, cancer cells uncouple the growth program from its environment, meaning there is no limit to proliferation, unlike non-cancerous cells. Cancer cells essentially become immortalized. Angiogenesis is the physiological process through which new blood vessels form from pre-existing vessels. Proliferating tumour cells seem to have the ability to encourage blood vessel growth to obtain all the required molecules for further cell growth. The final original hallmark is resisting cell death. Any population is determined by both proliferation and the rate of cell death. In a tumour, cancer cells can evade apoptosis, the natural cellular death mechanism, and not die. 11 years after their initial hallmark publication, Hanahan and Weinberg added 4 more hallmarks to their cancer hallmark diagram. In addition to the original 6 hallmarks, the cancer hallmarks now include avoiding immune destruction, tumor-promoting inflammation, genome instability and mutation, and deregulating cellular energetics, taking the total number of cancer hallmarks to 10. The circled labels around the edge are the hallmarks' plausible therapeutic strategies that could be used to oppose the associated hallmark. We won't cover these newer hallmarks, but feel free to read about them in your own time following the link in the bottom left corner of this slide. So now that we've covered the distinct features that cancerous cells show, we now need to get back to the links between obesity and cancer. According to Cancer Research UK, obesity is the second biggest cause of cancer, with 1 in 20 cases being linked to an excessive weight. In fact, reducing your weight can actually decrease the likelihood of 13 different types of cancers. However, I have a bit of an issue with one of these facts because obesity does not cause cancer, it only increases the risk of developing it. Just because you are obese does not mean that you will in fact 100% develop cancer later on in life. You are just more likely to get it. Instead of telling you the mechanisms that link obesity and cancer, I want you to find out for yourself. I want you to apply your scientific knowledge and apply it to real articles about the mechanisms through which obesity increases cancer risk. These articles have been simplified and reduced to a single page of text and figures only to help you. Normally these articles could be up to 20 pages long, but thankfully for you, you've only got 1 page to read. You've been given a worksheet saved as activity_2_worksheet, and an example of the required level of information is given to you based on the adipokine-adiponectin mechanism. The references for each mechanism have also been done for you. You've also been given a document with 3 articles needed to gain all the relative information, and these are saved as activity_2_articles. This activity should take you between 10 and 15 minutes, again, similar to the first activity, so good luck guys. The next slide will be left on as you complete the activity. This allows you to see the publication about the newer hallmarks with all the possible therapeutics around the edge. So these are the answers gathered from the 3 articles given to you. We're not going to go over them at this moment because there's quite a lot of extra reading that requires further knowledge on these, but you have got the references for all of them, so if you want to read more about the subjects, feel free to. Now that you've completed both activities and you've listened to the recorded slides, you should have gained some detailed knowledge about obesity as well as the health risks that are associated with excessive adipose tissue. If you could now complete the evaluative quiz given to you as evaluation_quiz_PDF, then similar to the first quiz, take a photo of your answers or make a note of it. That would be very helpful. Thank you, guys. In case you're curious, here are the first 8 questions from the quiz that you've just done, and here are the answers. If you could not change your answers, because I'd quite like to see if you've learned something from this presentation. Thanks, guys. Since you've completed that final quiz, that brings us to the end of the session. So firstly, thank you for doing so. Thank you for taking part in this. You don't need to be worried about anything. Your quizzes will not be marked. It's just to see if you've learned anything from today's session and to know if you've been taught enough about obesity and cancer and other diseases associated with obesity at school. So it's purely just for me to see. If it's possible now, since you've taken photos of your starter quiz and evaluation quiz, if you are able to email me to the email on the slide, that would be very helpful. And if you could save them using the naming system there, so if you name it project_quiz_ your surname, so example, if I was going to do it, I'd have project_quiz_back. Once I receive your notes or photos of your completed quizzes, I will enter you into a competition, and one person will be the winner of a £20 gift card. So thank you very much everyone for completing today's session, and I look forward to seeing some of your quiz results.